Okay, it's 11. Good morning to everyone. My presentation has the following title: Neurodiversity, a Behaviour Analyst Perspective. I'm NICOLOSI, a BCBA and PhD student at University Belfast. My supervisor is Professor Karola Dillenburger, Director of the Center for Behaviour Analysis. And we have here with me the Data-Driven ABA group, which is my working group. So, a very important disclaimer: I'm not an English native speaker, and since my English is far from being acceptable, I think, please ask for clarification at the end of the presentation in case I would use any term that is not, I wouldn't say kind enough, but politically correct maybe, so I can have the chance to better clarify my position and my view. This is a sensitive topic, as you know, so it's better to not go any chance. So let's talk first about autism diagnosis. As you all know from the DSM-5, the subcategories of the pervasive developmental disorder that we had in DSM-4 are no longer available. They have been merged in just one single category, which is autism spectrum disorder, producing a strange effect. Now we have this diagnosis that is attributed both to highly articulate adults, able to live independently, to self-advocate, and at the same time to people that are very vulnerable and need constant assistance. Today the diagnosis is still purely behavioral. It's made by a mixture of observation, some measurement with formal testing, self-report, and a curious phenomenon is self-identification, which is becoming a new way for producing these diagnoses, or at least to call oneself autistic. There is no clear genetic or environmental factor for predicting autism, and a lot of studies concentrate on genetic factors, but there is no clear evidence. There are other studies that are underrepresented that environmental causes as exposure to toxin, parental age, and nutrition, and also some behavioral causes have been proposed as a cause for autism by Russian Tudor, 2004. The prevalence is disconcerting. As you know, the rate of autism is constantly raising. Now, about the neurodiversity movement, in 1998, the Australian sociologist Judy Singer used for the first time the term neurological diversity or neurodiversity to define autism, ADHD, dyslexia, and some other condition. It's curious that later some highly articulate adult with autism launched a social movement, which name is Neurodiversity Movement, very present on social media, using this term to self-identify. Basically, they fight against discrimination, they sustain people with autism. And during the pandemic, the movement thrived because, of course, of the massive use of the social media that the majority of people produced in that period. According to the neurodiversity movement, autism is not a disability, as classified in DSM-5, and people should be proud to be autistic, not with autism. This is very important, not people with autism, but autistic in their terminology. So they support and try to diffuse, to spread an autistic culture. They would like to unify all people with autism, or all autistic people, under just one label, which is autism. So no autism spectrum disorder, just autism. And they strongly propose to abandon the distinction between level of functioning. They don't want to be, for example, in conferences or people around to talk about high-functioning autism, low-functioning autism. They consider autism just a normal variation of the humankind, and so no therapies are acceptable, because then there's nothing to be cured, there's nothing to be corrected. In Presenting this topic, of course, is better to give some hint about the distinction between medical model and social model of disability. The medical model of disability see disability as an impairment of the person. So disability is a private fact. It's something that is related to the person themselves. The social model of disability is quite the opposite. The people who use this model to define disability talk about the encounter of the person with his or her environment. So disability is not a private fact, but it's something that is social. In case of autism, social model of disability means that the social rules are a barrier for people to thrive, to be integrated, to be included. Of course, the neurodiversity movement show a clear preference for the social movement, but this is the first contradiction. They put a lot of emphasis on the neurological causes, the genetic causes of autism. So they base the justification of their condition on the medical model, but at the same time they exclude the medical model, considering it discriminatory. And this is contradictory, of course. The medical model seems to be invoked by the supporters of the neurodiversity movement just when it is convenient, to justify their condition. So basically to tell people, I'm like that, it's a genetic condition, I have an autistic brain, there's nothing to be done, there's nothing to correct, there's nothing to cure, allow me the term. But at the same time, medical model is evil, is hated, is debated, because it's discriminatory. Of course, this position involves a lot of controversies and debate. The following points, in fact, are at the core of the neurodiversity movement: fight against barriers, exclusion, oppression, stigmatization that they sustain people with autism suffer from. The social rules, as I said before, are seen as the main barrier to the full inclusion of people with autism. So society should be accommodative. Society should change social rules. They insist on terms as ableism, any kind of intervention that is aimed at correcting a person with autism behavior is considered a form of ableism, and so discriminatory and unacceptable. And the majority of people, probably outside, I hope, this conference, listening to this kind of argument would of course support the neurodiversity movement, because the majority of these points, fight against oppression, include people with disability, of course are values, shared values of our Western society. However, if we take a deeper look to the values of this neurodiversity movement, we discover something that is preoccupying, disconcerting. For example, it seems they sustain, or at least a great majority of them sustain, there are even books published on the topic, that even educating a child is problematic. And then teaching a child new skill is problematic. Enhancing independence is problematic. So according to their view, it seems that when a person receives a diagnosis of autism spectrum disorder, or when a person self-identifies with the autistic diagnosis, the autism diagnosis, is untouchable. Everything is allowed, and you cannot intervene in any way, because changing, for example, the gaze is necessary to teach gazes for teaching, for every purposes. I will gladly answer to questions later. It seems to be wrong teaching eye contact. They seem to support the notion that teaching eye contact is like a torture, bring the person to suffer. But there's no evidence of this at all, unless we consider self-report. But self-report are a thing, science is another. Reduced challenging behavior also can be problematic, because challenging behavior are viewed as an expression of the autistic nature of the person. So again, untouchable. Society should be accommodated. The child should not be changed. Let's think about a typical child going to school. When he says to his mother, when he throws tantrums, I don't want to go to school, I want to play PlayStation, is he allowed to stay home? Or we force him to do instruction, to receive an instruction to go to school, because it's for his future. It's the same situation here, but it seems that once you have an autistic diagnosis, everything is allowed, everything is justified by the diagnosis in itself. So every kind of intervention will be automatically considered discriminatory, belligerent, normal, the product of a normalizing agenda. This term is recurring in the literature. So, it doesn't matter, of course, that behavior analysts have a lot of evidence supporting intervention for people with autism. It doesn't matter that behavior analysts have an ethical code. We will briefly discuss it now. But the majority, a great group of people supporting the neurodiversity movement seem to have set on their side the work of behavior analysts and attacked them, attacked the institution, attacked the single professionals. We also have been attacked for months. And at some point we had to cut this kind of communication because it was impossible to have an intellectually honest debate with the people who were attacking us. To reference Vice 2022, it seems that it's a zero-sum game. The people on the neurodiversity movement are gaining success and visibility at the expenses of the people on the other end of the spectrum, because they are basically contesting, contrasting the intervention to support them. Of course, there's no need for such a game. We behavior analysts have an ethical code which prescribes us to first benefit others, do not harm, treat others with compassion, dignity, respect, behave with integrity, and ensure competence. Clearly, behavior analysts have much in common with the neurodiversity movement. Behavior analysts also are firmly eradicated in the social model of disability. We acknowledge the limitation of the medical perspective, circular reasoning. He does that because he has autism. No, it's the other way around. It's because he does that we say he has autism. And we try to analyze the language trap that this kind of mentalism exposes the public to. We intervene on the circumstances, on the environment, and we try to change behavior, to teach new behavior, new habits, new routine, intervening on the environment, not trying to change the person. We do that according to universal rules that are true for me and you in this room, for people with autism, for the majority of the animals. So we are not producing an intervention that is devoted and is built like a method for autism, but this is one of the major misconceptions, that these people seems to be determined to diffuse, spread. They talk about ABA as a method for autism invented by Lovas, without any chance to be correct. We recognize that autism is a summary label, but summary label for behaviors, not for any inner condition of the person, but because the diagnosis says that. We have no points, we have no discoveries that allow us to say autism is something that the person has within and that cannot be changeable. So we promote socially important behavior, inclusion, independence, quality of life, and we do that, we as behavior analysts, according to evidence-based literature. We do not propose theory, we propose intervention that have been studied and that have been proven to be successful. That's a great responsibility, and we should be proud, I think, to say that as behavior analysts, because in other fields it's not like that. Other fields usually propose theory or propose what the professional likes much. But that's not the point. The point is I provide helping intervention because someone is in need, and it's my responsibility to provide the better evidence, the best intervention possible according to evidence. But of course, according to the neurodiversity movement, autism is a mutable is unmodifiable, is part of the person's biology, is a lifelong condition without any chance to be changed because the person is like that. This is the person. If you try to change the person, she or he will masking his own proper nature, which is something completely invented. But it's something that people started to say within the movement, sprout, and that had a great appeal on many behavior analysts, with my surprise. But we have zero evidence of that. So some people on the neurodiversity movement completely reject behavior analysis on the basis of its foundation, not only as an intervention for autism. While we try to teach people to make friends, to go to school unaided, to take part in the everyday social life, they contest every kind of intervention. Also, the term indistinguishable that ran through the ABA literature about autism. There are some presenters in this conference that are debating in these days about this term. It seems that this term has been picked up by these people as the explicit clarification of the fact that we want like to convert people with autism to something else, make them the same as others. But when we behavior analysts use this term, we do not think about that. We think about making people able to join social life with his own features, characteristics. We don't want little robots. We want the person to have the same opportunities of all the other people. Of course, even like this, behavior analysis is called abuse, violence, mind control, and we behavior analysts are many times defined as like Nazis. And we too, as that's even a behavior group, have been called like that. After having devoting a life to the helping profession, we are Nazis. We are doing violence, abuse. Do you really think that? Many parents and caregivers of people on the other end of the spectrum, not the lucky one, the one who really needs our help, of course are debating this, are contrasting this movement. They support behavior analysis. They really think their child needs to be taught new skills, and they see the benefits of it. But the problem probably is that they are too in the managing of their own life, helping people, helping their own children to have the chance to publicly debate these topics. And the result of that is that the supporters of the neurodiversity movement are basically getting the scenes now. And also behavior analysts are following them. So we propose two different solutions to this debate, to this problem. First solution, the term neurodivergent or neurodiverse could be employed for those who self-identify under this term, who do not have clinical diagnosis, do not require clinical support, do not require behavior analyst, for example. What are the advantages of this solution? They could free the clinical diagnosis of autism spectrum disorder, and they can grant access to support for those who need it. Also because parents have been attacked. They received threatened publicly and privately when they say to support behavior analysis and to provide behavior analysis to their own children. Of course, I'm not saying the whole neurodiversity movement is doing this, but there are some extremists that are doing this. Behavior analysts would be able to help those who need their support rather than spending their time and energy in trying to correct misinformation. A second possible solution could be that the neurodiversity movement really evolved in a movement that represents the entire population of people with autism. That would mean stop representing those as people with autism, just those who have the skill to self-advocate, to include people that have much profound needs and need serious intervention for supporting their independence, their future life, and they should stop quarrel and defame professional behavior analysts who have dedicated a life of training and helping others. The advantages in this case would be that the neurodiversity movement would speak for the entire population without this internal debate, without this contradiction, and of course they would receive also the full collaboration by the stakeholders of people on the other end of the spectrum. Basically, we could join our efforts to try to defeat the most challenging of our enemies, which is social inertia. So I hope these two solutions could help in some way, and I'm totally open if you need any clarification or want to debate a little this topic, we have time. Thank you.